October the 31st saw the opening of the Canadian Conference on Global Health in Ottawa. This year's theme is Global Health, a humanitarian crisis.
The day is called Pathways to Global Health Competency, and we have become increasingly aware of the need to ensure we all prepare to work in the global arena. Whether that is as practitioners in service delivery, researchers, or as negotiators on the diplomatic stage, we need skills, we need sensitivity, and we need to build these networks to support each other.
The keynote address for the opening plenary was given by the University of Toronto's James Orbinski, former international president of Medecins Sans Frontières. He spoke about the need for equity in global health.
And if I've learned anything, I've learned that there are no easy answers. And I've learned as well that to the extent that one is willing and able to live in paradox and in contradiction, to the extent that one is willing to live with risk and with potential failure, this is the extent to which equitable, viable, and hopeful solutions are possible. Now, how does one see possibility? Well, as I said earlier, it does not lie in naive utopian dreams. It lies in what we actually do. The most innovative and politically transformative ideas in the pursuit of greater equity of the last 200 years, have been driven by engaged citizens who acted. The abolition of the slave trade, the emergence of labor rights, children's rights and women's rights, civil rights for African Americans, reform of the post-World War II and post-Cold War rules of war, the environmental movement, the global health movement, some of which I've talked about today, are each examples of transformative political ideas that are rooted in notions of equity.
Nicholas White of Bangkok University and recipient of the 2010 Canada Gairdner Global Health Award closed the first day with his lecture on malaria control and elimination.
About 1/5 of the world's population has malaria, as you're sitting there, and every day about 2,500 people die from malaria. And most of those are children, and most of them are in Africa. So this is a huge preventable morbidity and mortality. And this makes malaria the most important parasitic infection of human beings. With the removal of malaria has come prosperity. I'm not saying it's entirely causative, but health economists have argued that negative economic growth in Africa can be attributed entirely to malaria. So this is quite a significant impediment to human development.